Before the pandemic, Robert Hatfield was selling chocolate to the masses. Now he's volunteering to catch the virus for them too.
If you can do something and you can help, then that's something that I'm willing to do.
There are dozens of vaccines in the testing phase, but waiting for participants to be naturally exposed to COVID-19 takes time. So UK scientists plan to deliberately infect healthy volunteers between 18 and 30 years of age.
The probabilities of me dying or anything is very, very low. And so when I think about what society gains by getting a vaccine sooner, I'm not that worried about the risks.
First, scientists will determine how much virus it takes to infect someone with COVID-19. The volunteers will be given a dose as a nasal drop, then treated with the antiviral drug remdesivir as soon as they're infected. Once an appropriate dose is identified, scientists could run a series of trials testing several vaccines.
That's really the end point of the study, is not them getting high fever or hypoxic or anything of that sort. We're hoping not to see that at all because we're starting with such small, cautious doses.
Volunteers can expect to live in a clinic for at least a fortnight and be paid about $8,000. There are ethical issues because the long-term effects of the virus remain unclear, but not acting has its own ethical implications.
Some people will give a kidney to a stranger. Some people will give their lives for their country. I think it's entirely reasonable to allow people to be altruistic, especially when their sacrifices could save hundreds of thousands of lives over the next months.
The study still needs regulatory approval. If it gets the go-ahead, scientists will start infecting volunteers in January, with results expected by May next year. Nick Dole, ABC News, London.